Good morning. My name is Dr. Gordon Wise. I'm going to talk to you this morning about diabetes and how it affects the eye. This is the normal human retina. It shows the optic nerve here, the major blood vessels coming out from the back of the eye, and this particular part of the retina, which is extremely important, the macula. Diabetes affects the eye in a number of different ways. It can change your need for glasses, and this can be very variable indeed when somebody first becomes diabetic. It can cause cataract, and if you go to our Captivate program on the website, you'll find a discussion about cataract and diabetes. But diabetes can also affect the retina. It starts to affect the retina by causing changes in the capillary bed. Now, capillaries are tiny blood vessels which are between the arteries and the veins, and the retina is very rich in these indeed. This whole area here is full of capillaries, and these nourish the very centre of our retina, the important bit, the macula. Here is somebody whose retina is being affected by diabetes. We can see numerous little dot hemorrhages here, right scattered throughout the fundus, as well as some early exudates where fat and fluid is leaking out of the blood vessels into the retina. This is another picture of an eye affected more severely with diabetes, where these changes have become more evident, more hemorrhages, more exudates, and the very hint beginning here of new blood vessels, tiny, very fragile capillaries which grow on the optic nerve head. This is a picture, again, a little bit further on in this person's evolution of their retinopathy, where these new vessels are more evident on the optic disc. This is potentially a very dangerous situation. This, unfortunately, is somebody whose diabetic retinopathy has got to quite an advanced stage, and there are a myriad of new leaking blood vessels on the surface of the retina, which unfortunately can end up like this eventually. This person will be functionally blind because of hemorrhage, etc., which occurs in the retina from untreated diabetes. Here is somebody who's been treated with laser, and these little black dots around the periphery represent laser treatment in what was called a panretinal photocoagulative pattern. This is commonly done with diabetes, where the new vessels occur on the disc, which is a very serious side effect of diabetic retinopathy. There are many different ways that diabetes can be evaluated in your eye, and this is a relatively new technique called ocular computerized tomography, or OCT. And here one can see fluid actually present in the very center of the eye in the macular area. This is a particularly serious effect that occurs with diabetes and leads to a great loss of vision. What happens with diabetes when it gets severe is that the fluid in the center of the eye causes what we call clinically significant macular edema, and this is a very serious complication. Macular ischemia occurs quite late, where there's no blood flow in the center of the macula, and that leads to blindness as well. Vitreous hemorrhage can lead to blindness, as indicated on this previous slide. And proliferative retinopathy and traction detachment. These are all very serious complications of diabetes. So, it's very important in diabetes that your diabetic status be well controlled. Your doctor will be doing hemoglobin A1C tests on you. It's very important that that hemoglobin A1C reading stays at about 7%, not much more. This test is usually done every 3 months by a GP or specialist doctor. Lipid control is important as well. Statins are often used to treat diabetics who have high cholesterol, etc. The blood pressure is extremely important, and people who are diabetic should have their blood pressure very carefully monitored, and the recommendation is 130, which is the top reading, systolic, over 80, the bottom reading. This is a slide that indicates that people who have a hemoglobin A1C of 7% do quite well in the long term, some years into the study, about 10 years in the study. People who've got 8% do progressively a lot worse, 9 and 10 and 11%. So it's not arithmetic. 8 is quite a lot worse than 7 and 9 is a lot worse than 7. So it's very important to keep the hemoglobin A1C level down, which of course is a measure, it's a very good measure indeed, of the status of your diabetes and how well controlled it is. All in all, diabetes can have myriad different effects on the eye, but the most important one is its effect on the retina. The effect on the retina can be averted with good diabetic control and good control of blood pressure. A patient who has diabetes should have their eyes checked by a medical specialist every 2 years. It's very important. If any changes are present, then effective treatment needs to be instituted early. If you have diabetes and you're worried about your eyes, just ask to be referred to a specialist for evaluation.